name's Kate Breslin. I'm the president and CEO of the Schuyler Center for Analysis and Advocacy. Welcome to our annual State of New York's Children, affectionately known by us as Sonic. So, good morning and welcome to Sonic. This year, the Schuyler Center for Analysis and Advocacy celebrates the 150th anniversary of our founding by Louisa Lee Schuyler. A tough, strong-minded, independent woman who wanted to advance policies that would focus on people who were most disenfranchised. Today, our work to advance policies that enable all New Yorkers, particularly low-income families and children, to thrive remains grounded in her ideals of compassion, advocacy, leadership, and partnership. As many of you know, we ground much of our work in partnership. None of us can do this work alone. I want to note that we've built in some time for, a good amount of time for questions at the end, and we want to ask folks to wait for questions till the end so that each person gets a chance to touch on their subject areas. And I'll start by introducing our team. So not here in front of you, we have Nicole Correa, our Director of Communications, James Farrell, Administrative Support Coordinator and film maker, Helen Smith, our Director of Finance and Operations, and a couple of folks who are back at the office. And then here next to me, we have Crystal Charles, Senior Policy Analyst, Dede Hill, Director of Policy, Lara Kassel, Medicaid Matters Coordinator, and Bridget Walsh, Senior Policy Analyst. Yeah, I went a little out of order, they were alphabetical. When Louisa Lee Schuyler founded SCAA in 1872, her goal was to improve the well-being of people living in state institutions due to poverty. That was at a time where we had something that were called poorhouses, which I think some would argue still exist in different forms today. She witnessed firsthand the inhumane conditions in state institutions. Lack of ventilation, poor food quality, no place to bathe or use a toilet. And she insisted that others observe. And based on those experiences, she raised her voice for change. She achieved her goal with like-minded friends and advocating for state laws that centered those most in need, which is what we try to do today, shine the light on issues and people who sometimes get overlooked and seek policy change to improve. In doing that, Louisa set the course for the next 150 years of Schuyler's advocacy rooted in compassion, evidence, and a belief in a government that works for the greater good. Our mission relies on collective action, on you, like Louisa, who gathered like-minded friends and people in every community across the state to push for better care of New Yorkers living in poverty. We remain rooted in partnership. And like our founder, we believe that good public policy, informed by data and real people and their stories, is a tool for meaningful, impactful change. We have a story to tell today. The data provide the facts, the structure, and the detail about the who and the where. Today, our team will share the facts and provide context about the data. There are some facts that are encouraging. A good number of New York children have health insurance coverage. A growing number of families are eligible for child care assistance through subsidies. There are some facts that are frustrating. Child poverty in New York remains consistently higher than in other states. Most children who are separated from their families and placed in the child welfare system are taken away without having received preventive services. A third of New York households that pay rent and have children report being behind on their rent payments. And more than 20,000 children in New York City slept in a shelter in December 22. The facts about the persistence of racial inequity are clear, compelling, and infuriating. children in Black and Latino families experience poverty at much higher rates than non-Hispanic white children. And Black children are 5 times more likely to be in child welfare placements. All of these facts and their stories are interrelated and intersecting. And we need an array of solutions across an array of budget tables, agencies, policy areas, and communities. We need leaders willing and able to listen, understand, and make investments for the future. New York State recently made a statutory commitment to cutting child poverty in the next decade through the Child Poverty Reduction Act. We know what works, we have the tools, and we'll talk about some of them today. And the end of the story, all of us, we get to write it. We get to create it. The facts and the stories are the result of public policy and budget choices. And the policy and budget choices we make in 2023 will impact our children for a lifetime. We know what works, and we have the tools. So I'll start by talking a bit about poverty. Allowing children to live in poverty is a policy choice. Poverty steals opportunity. I think that as an accelerant, any challenge or concern a child faces, health, mental health, academic, is likely to be exacerbated by poverty. Poverty is like throwing fuel on an already burning fire. Many children who experience poverty face significant challenges in the form of poor health, physical and mental, academic obstacles, lower earnings for the rest of their lives. Reactive interventions in the out years through the provision of public benefits later or interaction with the criminal justice system are far more costly than meeting the needs of children and families from the beginning. By any measure, New York children are more likely to experience poverty than children in the US as a whole. In 2021, approximately 747,000 New York children, nearly 20%, experienced poverty. And as many of you know, the poverty threshold is a very low threshold. Often we talk about near poverty, and if we're talking about families who are low income or near poverty, we need to double the number of kids. Black and Hispanic children experience poverty at higher rates due to structural, historic, and ongoing racism in housing, employment, education, policing. Among the lessons we learned from the pandemic, is that government has the capacity to quickly and sharply reduce the number of children experiencing poverty. The expanded federal child tax credit, when it was in effect, by itself cut child poverty by 43% in our country. And New York State recently enacted the Child Poverty Reduction Act, committing the state to reducing child poverty with attention to racial inequity in the next 10 years. It creates an expectation that state budget decisions will be assessed for their impacts on child poverty, and that the state will measure progress on child poverty with attention to racial inequity over time. The Act's Child Poverty Reduction Advisory Council is charged with making recommendations about policies that will have a measurable impact on child poverty. Income transfers to families, even modest ones, can improve outcomes. They can improve outcomes in health, educational achievement, future earnings. Yet young children are excluded from New York's child tax credit. They're more likely to live in poverty and more likely to suffer far-reaching negative consequences as a result of experiencing poverty. Among the policies that could reduce child poverty are robust refundable tax credits, including improvements to New York's child tax credit, the Empire State Child Credit. Policy changes that could make a difference would be including children who are under age 4, who are presently excluded from New York's child tax credit, restructuring the credit so that the highest amount of the credit would go to the lowest income people, increasing the amount to provide families with really meaningful support, and ensuring the credit continues to be available to as many immigrant families as possible. That's just one of the evidence-based solutions we're looking at and thinking about when it comes to addressing child poverty. So we're eager to work with you all to continue to assess public policy's impacts on poverty over time, to implement and strengthen robust refundable tax credits. We're excited about the governor's proposal about indexing the minimum wage. We think it should be increased and indexed, and making sure that there are a whole array of supports to any family who needs them. So I'll hand over the podium to my colleague Crystal, who will talk about child welfare.
Thank you. Good morning, everyone. So, true child welfare is achieved when New York's children and families can easily access resources and supports of their choosing, provided by and for their community. To better explore the issues in the child welfare system and potential solutions, I'll first provide an overview of what happens when children and families become involved in the system. So what is New York's child welfare system? The way that children and families become involved in the child welfare system is by reports mandated reporters and other New Yorkers make to the State Central Register, or SCR. In 2021, the SCR received 145,684 reports. Once a report is received, Child Protection Services, or CPS, investigates. A CPS investigation is a deeply traumatic process, especially because caseworkers have the power to remove children from their homes. If neglect is determined by CPS to have occurred, the caseworker may offer prevention services to the family. In 2021, 75,088 children and 37,516 families received preventive services from the child welfare system. Child welfare prevention services are designed to prevent the profound trauma of family separation, but don't always. They include home visiting, housing assistance, childcare, and cash grants. Neglect is defined so vaguely that, due to bias, lack of cultural awareness, or outdated practices, cases involving children and families living in poverty are often defined by CPS as neglect cases. If maltreatment is found to have occurred, a child is removed from the home and placed in state custody, which can be in a foster family, an institution, or with a kinship guardian. In 2021, 14,458 children were in the child welfare system. At each step of this child welfare process, disparities exist. New York's child welfare system currently operates in ways that disproportionately involve, investigate, and separate Black and Latino children and families. The disparity index data for children involved in the child welfare system has been publicly available since 2015, but the rates have stayed similar over those 6 years. Black children are over 5 times more likely to be in child welfare placements as white children, and note in the graph that indicates an extreme disparity. Latino children are twice as likely, and the graph shows that this indicates a high disparity. More needs to be done to combat the factors driving these disparities, including bias, discrimination, and child poverty. In 2021, New York began implementing Family First, a federal law. Family First limits federal funding for institutional settings to the first 2 weeks, unless a child has a demonstrated therapeutic need to be treated in such a setting. 1 year in, New York's institutional placements, long at a greater percentage than the national average and 26 other states, has barely budged. Lack of investment in community supports and wraparound services is one of the barriers to reducing unnecessary institutional placements. Reducing these placements will take a coordinated effort across multiple agencies to better support children and families in their communities long before they could become involved in the child welfare system. The second part of Family First is funding for preventive services. New York's prevention plan was approved August 2022. Most children who are separated from their families are removed from their homes without receiving child welfare prevention services. Too often, prevention services are provided too late or not at all. New York is decades overdue for a transformation of its child welfare system. In order to achieve real change for the nearly 150,000 children and families involved in the system and their communities, New York must end child poverty, expand access to childcare, invest in affordable housing, including housing subsidies, one of which is available to children and families as a child welfare prevention service, and improve the transparency and accountability of the child welfare system. I'll pass to Dede.
Try not to be grip. All right. Good morning. I never thought that I would feel such joy as I did this morning when I was waiting in line for the elevator in the elevator. Brought back a lot of memories. And that was at 8 o'clock, and there was literally no one here, and yet I had to wait 5 minutes. So I shudder to think what it's gonna look like later today. But it's so nice to be able to be together. It's been a long time. So my job today is to discuss and evaluate how New York is doing in the area of providing New York children with access to high quality childcare, pre-K and after school. And this is a great job because New York has actually made a lot of progress in recent years. So I'm excited to talk about that, but there's also a lot of work to be done. So let's first just talk about the why. Why is broad access to these programs so important? And there are lots of reasons. Access enables parents, particularly mothers, to work and for families to establish economic security, achieve economic security. It reduces parental stress, allows parents to work, to go to appointments, to juggle all of their many responsibilities, knowing that their children are in a safe, enriching environment. Access to high quality childcare and pre-K and after school also leads to better health, better cognitive and social emotional skills for our children. And broad access is also really good for business. Businesses in the US, they lose billions of dollars each year to lost productivity because of all the childcare challenges that parents, their workers face. So with all of those benefits, let's talk about the barriers. What is standing in the way of really broad access? The number one barrier is cost. Without childcare assistance or subsidies, we sometimes refer to them as, childcare is financially out of reach for almost all New York families. It's not uncommon for a family in New York with 2 kids to pay more than $30,000 a year for childcare. And I know many of you come from communities where the price tag is much, much higher than that. These costs often leave families facing childcare bills that can be 25% of family income, even 50% of family income, and compare that with the affordability standard that the federal government has identified, which is no family should pay more than 7% of family income. So the math does not work for families. So let's talk about the good news though. Last year, New York dramatically expanded access to childcare assistance, raising the income eligibility cap from 200 to 300% of the federal poverty level. And we estimate that makes about 265,000 New York children newly eligible for childcare assistance. And as you can see from this chart, that what that means for an individual family is potentially life-changing. You see childcare bills monthly bill going down by more than $2,000. And this is the reality or the potential reality for many families right now. I'll also note that the governor in her State of the State has proposed an even larger expansion up to 85% of the SMI. So if that's passed, more families will soon have access to child care assistance. I have to pause here and point out there is one group of New Yorkers who are excluded from that expansion, and in fact are excluded entirely from child care assistance, and those are immigrant families whose children are barred from accessing federal child care assistance. New York City is in the process right now of implementing a program to extend access on equal terms to all of its children, all of its immigrant children. And it is imperative that New York State follow suit this year. All of our children deserve and need access to high quality childcare. So, can't overstate the importance of the expansion of access to child care assistance. However, these expansions, they will be meaningless if families can't find a spot in a child care provider in their communities. And as this chart demonstrates, we are down. Capacity is down 2% from pre-pandemic levels. And that might not seem like a huge downward shift, but we went into the pandemic with 64% of families living in what we call child care deserts. So in their communities, there was one spot for every 3 kids who needed care. So we can't afford to lose any capacity. This downward shift matters, and we need to turn it around and turn it around quickly. I also want to highlight one point that this chart demonstrates. Where we're seeing the biggest loss of capacity is in our family-based care, and that is a tremendous concern. So family-based child care, they disproportionately serve families who are receiving child care assistance. They are more likely to provide care to families outside of 9 to 5 hours, and there is tremendous need for that. They also are a group of providers that are more likely to reflect the ethnic background, the linguistic, the language that children speak at home in their programs. It's really, this is a unique strength of New York's child care program and system. We have more family-based providers than most other states. It is, we need to act quickly to save and support this sector. One of the reasons that we're experiencing this loss of capacity is we are also losing childcare workforce. And like capacity, we went into the pandemic with a workforce shortage. That shortage has only grown. We are down 8% in terms of the workforce since pre-pandemic. And why are we facing a workforce shortage? There are many reasons, but the number one reason is low wages. This workforce, which is almost entirely women, the majority identify as women of color, are paid an average of $34,000 a year. That leaves these workers experiencing poverty at twice the rate of all other workers in New York State. And it's really important to note that not only do these low wages hurt this workforce and their families, it also undermines quality. So low wages leads to high turnover. It leads to overtaxed educators. This really damages quality, and it's imperative that we take action on this year. And one other obstacle, families, they may be eligible for assistance, but they often face many administrative hurdles to actually seal the deal. There are processing delays and wait lists, too frequent recertifications, unreasonable rules. There are also variations amongst counties in terms of eligibility that can really cause confusion and inequities. There's good news on this front as well. New York has taken some really important steps to address some of these barriers. And the governor in her State of the State has proposed to do more in 2023. So we're looking forward to that. Solutions. So most importantly, the comprehensive solution, the most equitable solution for New York is to implement universal, culturally responsive, high quality child care for all. I was hoping for that. All families, no exclusions, no administrative hurdles to navigate, no benefits cliffs, a program that is funded adequately to pay the workforce a thriving wage and to provide high quality programs for all children. That is the end goal, and it's a goal that we should reach quickly. On the road to universal, here are some essential steps that we need to take this year. Immediately and in a sustained way, increase child care workforce compensation. Supporting and growing the workforce is the number one challenge that we hear from child care providers every single day. That is what is standing in the way of keeping their doors open. New York must also continue to break down barriers to access, starting by extending child care assistance to all children, regardless of their immigration status. And finally, New York children and families, they are better served when all of our systems are aligned and working together. And with that, I'm gonna turn things over to Bridget to talk about one of our other child serving systems.
Thank you, Dede. I want to start with this definition of health, just to provide a background for how we approach this section of the report. According to the World Health Organization, they define health as a complete state of physical, mental, and social emotional well-being, and not just the absence of disease or infirmity. Through that lens, the policies and programs that go beyond providing simple medical care, including those that alleviate food insecurity, provide child care, and reduce involvement in the child welfare system, all support maternal and child health. Experiencing poverty in childhood can have lifelong health consequences. Poverty can profoundly impact early childhood through many factors. For example, exposure to inadequate housing, poor nutrition, irregular healthcare sources, and high stress levels. But poverty also affects the health and mental health of parents and caregivers. And this is why the Schuyler Center looks at health through systems and how they can improve the lives of families. As we've heard before, Kate's addressed this issue, policy choices drive outcomes. And the policies of our health and our mental health systems are designed for the treatment of individuals. Dyadic services serve parents and child together, targeting family well-being as a mechanism to support healthy child development and mental health. And while there are different models of this approach, they all use primary care settings to screen babies and toddlers for healthy development, while also assessing adults for stressors such as depression, substance use disorders, intimate partner violence, unstable housing, and food insecurity. Treatment plans are made in concert with the mother and the child, and connections can be made to programs that support families and guide conversations on the best ways to support early learning, healthy disciplinary interactions, and caregiver-child bonding. And as you think today about what you've already heard about systems and the data, and as I talk a little bit more about health, think about how if we were making more connections between the systems and the child and the parent, we could be addressing some of these other issues as well. But the dyadic approach works best when children and their parents have access to comprehensive health and mental health services through a robust, stable health insurance. And so we actually have good news here to report. So let's look at coverage. When the pandemic hit, the federal government provided states with more funding to Medicaid as long as they kept all people enrolled in public coverage during the declared public health emergency. Children have benefited from continuous enrollment because their parents have not had to jump through hoops to keep them involved in insurance. And for years, New York has had a remarkable track record of providing health insurance coverage to children. A record that is a result of years of state policies that deliberately prioritized coverage. This graph represents all coverage, but when you dive down farther, you find out that 96% of all children eligible for Medicaid and Child Health Plus are enrolled in those programs. New York was able to keep its ranking as 5th in the nation for coverage for children, even during the economic disruptions of the pandemic. And New York ranks 9th in the nation for coverage of adults with dependent children. Only 6% of that population is uninsured. We think that is still too high, but we have been making policy choices that have made progress in that area as well. Unfortunately, the pandemic has taken a tremendous toll on the mental health of children and their caregivers, and many mental health needs go unmet. Almost 6 in 10 elementary and middle school-aged children went without treatment for a diagnosed mental health condition, and for older teens, that number only dropped a bit to 4 in 10. And a lot of this data was collected just as the pandemic was starting, so we're waiting to see the impact, although we have heard, and many of you have experienced anecdotally, that there's been increases during the pandemic as well. This is a sizable percentage of children not accessing needed services, and the inability to find treatment is among the reasons that the pandemic has been toll on children's mental health is recognized as a crisis. But mental health services are not only necessary for children. Parents also require early and consistent access to mental health services. The inability of a mom to receive mental health care can have devastating consequences for her baby, and her family. And we're encouraged that Governor Hochul has made mental health a priority, and we look forward to working to improve access to services, as well as on initiatives to increase and strengthen the mental health workforce. So what are some of the solutions? First, reducing child poverty is integral to improving health. So we're going to continue along those lines and making that connection. Also, New York must make two-generation approach to maternal and child health a priority. New York must reorient care to the needs of families, but it's going to take a concerted effort to redesign the processes of systems to be family-focused rather than adult-focused or child-focused. This means taking a hard look at policies that are inhibiting the growth of these services. For example, how care is reimbursed, how state funding provided to programs can be used. Can it be blended and braided? What populations can you use it for? Those things need to be discussed. And how and where providers can practice so we can expand and extend the workforce. A two-generation approach must also include significant investments in both mental health and early childhood developmental services by retaining the current workforce and expanding the number and types of providers in these sectors. This must be the foundation of a strategy to secure health for young children, teens, and parents. Now, I'm going to turn it over to Lara.
Thank you. Good morning. As Kate said, I am the coordinator of Medicaid Matters New York. Medicaid Matters is the statewide coalition representing the interests of people who are served by Medicaid in New York. we are not celebrating the kind of anniversary that the Schuyler Center is, but we are celebrating our 20th anniversary, which is still very exciting. Not 150, but 20 is still exciting. And I'm very proud to say that the Schuyler Center has been the home of Medicaid Matters for several years now. And so I and Medicaid Matters are housed at the Schuyler Center. There are now, according to the Department of Health's enrollment data, there are now over 7.7 million people in New York covered by Medicaid. We used to use the social, just even a few months ago, we used the social math 1 in 3, but it's now more than 1 in 3. We can't say 1 in 3 anymore. Medicaid and Child Health Plus cover 43% of all kids and 78, the vast majority, of children whose families have low income. So yes, Medicaid matters. So one of the things, the beauty of being last is that you get to harken back to some of the other things you've already heard this morning. And one of the themes that I think you've heard is barriers. We need to break down, remove barriers through policymaking. And one of the things that we are proposing, along with the Schuyler Center and many other organizations, is to remove the barrier of re-enrolling in insurance coverage for young children. Last year's budget, I should say it's this fiscal year, but the budget process last year enacted in the final budget a removal of the $9 premium for the Child Health Plus program. The Department of Health's data, when they were proposing, making this proposal, indicated that over 70,000 children moved in and out of coverage for failure to pay the $9 premium. Failure because they didn't, because they couldn't, because for a variety of reasons that doesn't happen. Either a family is not able to afford the $9 premium, or for a variety of reasons, because they forgot or what have you. 70,000 children have lost coverage, came in and out of coverage because of that barrier. This year, we hope to remove another barrier, which is the re-enrollment process. So we are proposing that New York take the very bold and positive step to provide continuous coverage for children to age 6. Birth to 6, whenever a child comes into coverage before the age of 6, they would stay on all the way through kindergarten, or to kindergarten, I should say. The state enrollment systems would simply mark a child as enrolled and they would stay enrolled. That would mean that the burden of having to re-enroll would be lifted. That barrier would be gone. Families could then focus on keeping their children up to date on preventive services and care during those very critical early years in growth and development. And we know, as Bridget talked about regarding the continuous coverage that has been provided to everyone in public coverage during the federal public health emergency, we know this can be done. So let's do it for young kids. We need to make sure New York is next. Several states have already received approval to do this, or they are in the process of applying to do this, to get approval to do this. Oregon was just approved to do this in September of last year. And when the Oregon Health Authority presented their data, when they were coming up with this proposal, they looked at the children who were coming in and out of coverage, and the kids who were disenrolled, and less than 1% of children who lost coverage because their families were now over income. That means more than 99% of children lost coverage for some other reason, like an administrative barrier. It literally got lost in the mail, or the documentation didn't upload properly, or perhaps think of all of the many other things, as we've already heard this morning, that a family has to juggle, and somehow, children fall through the cracks. They lose coverage for a variety of other reasons, aside from the fact that they actually went over income. So we believe, of course, that strong Medicaid policy is part of the solution, and we believe in all of the ways that all of these issues interact with each other, they are all interconnected. And so pulling the thread through here, ending child poverty is critical. It will impact on children and families in a variety of ways, and we believe Medicaid is part of the solution. We need to continue to remove barriers to coverage, as I've said. We need to emphasize the intent of the program. Too often, Medicaid gets into, during the budget process in particular, into debates over what Medicaid is and why we spend a lot on it and why it creates what some people consider to be a burden on our state budget. We must remember Medicaid is a success story in New York, as we've already talked about, as you've already heard. Medicaid coverage has been sustained in New York for a long time for all of the right reasons. The intent of the program is to provide high quality, comprehensive coverage for people. It's not perfect, that's why we continue to have jobs as advocates, but we need to remember why we have this program and continue to keep it strong. And then last but certainly not least, we want to use all of the benefits of Medicaid, all of the high quality comprehensive nature of the program and all of the things that it does to help the state reach greater health equity. This is a key theme to our work in a variety of ways, and we need to continue to beat that drum. So thank you, I'm gonna turn it back to Kate.
All right, right on. All right, now it's your turn. So I think you probably noticed there are some through lines here. And sometimes, we think of our work in different buckets, just like, at this time of year, a lot of us are thinking about the state budget and the different budget tables, and we always try and come back to some of the important through lines. Family economic security really matters to all of these buckets, to children's welfare, to parents' ability to thrive, to get to work, to family health. And prevention matters, so investing upstream before we see problems, before we see challenges is really important in all of these areas. And there are choices that we all can make today that will have an impact on our 4 million children for their lifetimes. So I have some questions prepared for our team, but I'm really excited to hear from you. If you have questions, ideally not really long comments or testimony, there'll be opportunity for that in a couple of weeks, I expect. But we're eager to hear if you have questions or comments. And if you wouldn't mind standing up and saying your name, that'd be fantastic.
I'm James Eulinger. I'm from Assemblyman Gray's office. I'm just asking, can I get an explanation about the 200%? You talked about 200%, and then you said 300% of the poverty. I just need an explanation of that. That'd be great.
Sure. So when we talk about the federal poverty level, it's an amount that's set by the federal government. And so for a family of 4 in the most recent year, a family of 4 who is living below the poverty level is living approximately at about $26,000 a year. And I'm looking at Jackie Orr from New York State Community Action Association, just to, you can wave if I'm screwing it up. Yes. You know the stuff. So about $26,000 is 100%. That's the federal poverty level, is 100%. And that's, again, for a family of 4, because the poverty level is set based on the size of a family. So if it's a 1 parent and 2 kids, it's less than that. It's, in the lower 20s. And so when we say 200% of the federal poverty level, it's double that. So, and so on.
Thanks.
Okay.
I'm Nicole Clark with Assemblyman Moore's office. So Laura, I have a question for you. When you were talking about the fact that Oregon just did this, so is Oregon the only state that you know of that has no re-enrollment from birth to 6? And does that based on what I was hearing, I might have zoned a little bit, I was thinking, was there a federal waiver required to do this?
Yes,
Okay.
so I believe Massachusetts, I think either
In
in
California.
and California.
Okay.
I don't know what the
Washington.
state, oh yes, thank you. I'm glad we're all here today.
Yeah.
I don't remember like where they all are in their approval processes, but those, Massachusetts, California, Wisconsin have all applied. And yes, New York would have to apply for a waiver in order to make that happen.
The way Medicaid is financed is for New York, about half of it is federal, and the other half is mostly state and some local. So typically if New York, if a state wants to make a significant policy change, it needs to ask the federal government for permission. Just a background. Please.
My name is Lara, I'm with the Assembly Member in the Rosenthal's office, and I had a question for Bridget Walsh. How can we make sure that this screening of both children and parents to ensure their well-being doesn't translate in more discrimination?
That's, yeah. Yes, is it a tough issue? Oh, yeah.
That is a tough issue. I think one of the things that, we wanna make sure, and it doesn't matter what they're screening for, that there are enough providers in communities and providers that, that know the culture, know the language, that come from communities, so that it's easier to get services and services that meet the needs of the individual family. I think one of the things that happens now is there's such a shortage in so many areas of providers that a provider that might meet your best interests isn't even available in the community. I know we did a work a few years ago, we're still working on maternal mental health issues, and access is one of the issues. And having culturally appropriate services available to a mother that's experiencing a mental health crisis is really essential to have her coming into care and getting the care that she needs. So expanding the number and types of providers, I mean, in some instances, if a woman, maybe, I'm using this as an example, who is experiencing a mental health crisis, doesn't want to see a physician. They would rather see a community health worker or a doula or some other type of provider. So I think one of the things that we're conscious of is, what is our workforce mix and how are we paying for them so that they can treat all communities? That provider access is one of the ways we can do that.
Fun fact, Bridget Walsh is also a national expert on oral health. We didn't get into the details on it, but if anybody has questions about children's oral health,
Thinking about teeth, yes.
Bridget Walsh. Assembly member.
Hi, thank you, Kate. So, Ms. Walsh, I want to follow up on that question. It was a great question about screening. Are you guys recommending some sort of trauma screening? Because we considered that briefly in the legislature a couple of years ago, and that was exactly the issue we ran into. We didn't want to stigmatize other kids. And then to follow up on that, how do you bolster that workforce? How do you do it from a policy perspective?
Well, and Kate and Lara can weigh in as well. We talk about screening for a lot of issues, whether it's developmental screening for children, maternal mental health, even dental screenings. We run into a lot of the same underlying problems, which is providers don't want to screen if there's nowhere that they can access services. And it'd be the same with trauma screening as well. So one of the things that we're always conscious of is, as we build systems, we're looking at the workforce, right? And the workforce is not only the number of people available, but the scope of practice of types of providers, and where we can be looking at what providers we already have in the community, and can they do the types of services that we need them to do. So we need a lot more data on health workforce. A few years ago, the state passed a bill to have the state look at health workforce data issues, and we're still looking for implementation of that. Kate, I don't know if you want to talk a little bit about the implementation of
Right.
that will actually get us that kind of data, that we know where people are practicing and what they're allowed to do.
Yeah, I think, as Bridget said, one of the challenges with screening is, and what you hear from families, is if we keep getting screened, if we keep going, to their pediatrician and then maybe to their primary care